So I would like also to share a very recent paper, actually, produced by every team under the supervision of Hassan Maghraby and Mohammed Fawzi. And this dedicated team has done a very interesting work, a big systematic review that is called the Umbrella Review. The background of the Umbrella Review is that systematic review and meta-analysis have some limitation. They are made by discrepancies and potential biases, diluting the strength of the evidence. But umbrella review is very strict and can be more precise in the evidence. So they have done a very big work, and they come to the conclusion that there is no convincing evidence or suggestive evidence linking SDFA with ART outcome. And actually, this umbrella review was the first to overview the reported reviews on the relation between SDF and ART. And they reviewed 15 meta-analyses and 7 systemic review. And they found that reviews suffered from a risk of bias and presented weak or non-significant evidence of associations. And biologically, several studies have reported the ability for oocyte to repair paternal DNA damage post-fertilization, which might explain the lack of any measurable association between SDF measured and laboratory and ART outcome. So given the lack of convincing evidence through their study, they are alarming clinicians that this type of studies has to be done in a research context only. And they included the use of extracellular sperm with ISD as the remains in invasive procedures with potential of harm, so they don't advise it at all. And similar techniques such as using advanced sperm selection have the potential to fail, so they are not sure that it can be helpful. And they are trying to make us, to bring us an alarm that we have to be very cautious upon recommendation concerning the SDF. So what is your feeling about their statement and their study?
Yeah, first of all, I would like to congratulate the teams for an excellent work. This is something that we all should be very happy to have something like this happen from colleagues working in the field. The point here that one of the issues, like I would agree regarding the XC in general, but there are some, like you cannot generalize everything. So there are some points here. So I agree that the female factors have a very important role, and there are very few studies. One of them is our study that show that female ages as a major contributor with the sperm DNA fragmentation, especially in XC cycle. But we have to understand that sometimes the female is not like a young female with a poor ovarian reserve or an older wife might not have the same capacity of improving SDF. The second and most important thing that the issue that we have, as I presented in my study, if you remember the study, the paper of the table of Dr. Ashok, that the reference range for measuring the SDF in different assays is completely different between different studies. So most of the study are using different cutoff for the same assays. Like tunnel, some of them are using between 15 till 30. CSA, the same thing. All of them use different assays. So the heterogeneity of the inclusions of the studies together are not homogeneous. Like these studies, these populations are not homogeneous. So it is very difficult to make a proper, clear conclusion. And I would recommend that we need more studies that are well designed, properly designed, trying to address, and we cannot put all the basket in one group, in one basket. Like not everybody with unexplained idiopathic severe oligo, everybody, some people who's having low SDF with somebody who's having very high SDF, all of them in one basket. This is not the right way to do things. So we need more studies looking into this. Simply, we can look into the semen analysis, simple semen analysis. From the first WHO manual, 1980 till today, we don't have clear evidence of what is the best reference range. So this is how much lack of information and proper studies that we have in our field, and that we should be promote having more studies in like this. So, but this is an excellent job. I cannot say any further, and it's very helpful. I totally agree about the XC and the IVF outcomes. I totally agree about that. Dr. Muhammad.
So I totally agree with Dr. Haytham and add my voice to him in congratulating the group for such a big, marvelous work. The umbrella review is very difficult to be done. It needs dedication, it needs time, and it needs a lot of statistical analysis and explanation. And I agree with the group that we should not advocate, as I said, 100% for the sperm DNA fragmentation. But we have to put in mind something. If we don't have the proof for the whole thing, we should not abandon it. We should not say that it is not beneficial, or that we should not go for it. Still, there are different studies, hundreds of studies from all over the world, from different researchers from the 6 continents, that say that there is a relation and that the DNA fragmentation is affecting the results of the natural pregnancy and maybe the IVF. ICSI is less, but still there are data that ICSI is affected by sperm DNA fragmentation, not of great evidence, but we can say there is no evidence, there is some evidence. So I believe what we can learn from this study, that, as Dr. Haytham said, we need more studies. We need to do more multi-center studies. We need to standardize our methodology and our cutoff values in a multi-center study, and then check our results. Maybe we'll find that it can affect, maybe it will not affect, but we should not abandon it for the sake of patients who are looking for increased chances of pregnancy following ICSI or chances of natural pregnancy.
But as you know, in Egypt, the cost is an issue. Not like in Doha, the cost is not an issue. So subjecting the patient to DNA fragmentation tests, which are relatively expensive, and doing extra procedures, which are also expensive, we need strong evidence to expose our patients for such techniques. Of course, we need more standardization, we need more research, and perhaps in the future we can find a way to help our patients. But I'm speaking because you know, in Egypt now all patients are having their DNA fragmentation test. All patients in the clinic, when the test is elevated, are minded and are directed to testicular sperm extraction. So we need to modulate and tell our doctors that we need to think many times before subjecting patients to this expensive and perhaps not sure maneuver.
Definitely, Dr. Medhat. This is why we said that first we should try for the non-expensive natural methods of treating it. And we should not test for DNA fragmentation except in certain populations. We should not go for testicular sperm except with failure of ICSI. But we have also to put in mind that these same patients who are asking about the cost will repeat ICSI cycles 3 or 4 times using ejaculated sperm and ending up with the same result. While up till now, in our experience, and with even there was a meta-analysis done by Dr. Estevez regarding using testicular sperm in high DNA fragmentation, they have a higher chance of pregnancy with ICSI. So again, we should not rush the patients to do this extra maneuver. It is a surgical maneuver and it is a costly test, but we should not deny them if they have repeated failures. So as you said,
that came with the society.
Yeah, we have to standardize them, keeping it in the clinical scientific context and not in the money paying context, as we say.
And we have to add to this now that we have the ESHRI guidelines and we have the ASRM, AUA, European Academy. All of them have agreed that to do the sperm DNA. They didn't agree about what to do after that. This is the point. No, but they agreed that you need to test it. So if you are testing it and having a higher results, So the patient is in your clinic now. So you have to have something that you have. So you have to use the available data that's giving you. So if a patient, so what's next? This is the question that he's going to ask you. So you can try to rectify it. You can try to use that, but you have your own ways and own methods. And I always recommend study your own population with your own methods, with your own availability, with your own labs, and get your own result and depend on that. But indications are there, not by us only, including societies, that clear indication, IUI, failed IVF, recurrent pregnancy loss, unexplained infertility. These indication has been there already. So if you're going to test it, what you're going to do? This is another question.